There are two main methods how to deliver hyaluronic acid, hyaluronic fillers inside the tissues. You can use needle or a cannula. Needle sizes are selected by their gauge. The bigger the number, the smaller the needle gets. Usually you will be injecting hyaluronic fillers with a gauge of 23, 25, possibly 26, but in rare occasions. The stiffer the filler is, the bigger needle you will find in the package. And a needle will be always in the same package with your syringe. The other method is the cannula. So comparing needles and cannulas. See, cannulas are completely different. Cannula is like a blunt needle. It's considered safer. If we push cannula to our skin, it will never puncture. It doesn't even puncture the glove because the tip is blunt. So cannulas, they tend to go to the direction of least resistance. So they are a little more difficult to insert. They require better skill. Needles always listen to the direction that we push them. Needles they may be considered easier to use, but they are more likely to cause bleeding or small hematomas. And when injecting with needles in the areas which are more vascularized, and it's a rare thing to find an area in the face which doesn't contain any blood vessels. Basically, with a needle you are always in risk, so always aspirate. When you place the syringe, the needle, in the area you want to inject, always take the plunger backwards and see if you get any blood inside the syringe. If you do, do not inject. Remove the needle and push that area for a while to avoid hematoma, because you might be inside the vessel. If you do inject in such occasion, you might cause vascular occlusion, which leads to big problems and complications. Cannula is considered safer to use, so when you're going to the areas with more vascularity, I always use cannula because it's always safer.